Isn't this supposed to be playing? Okay. Oh my goodness. Okay, so let us stop this. Okay. Hi. Hey guys. I haven't done a live stream in ages, so I actually don't remember what buttons to click. Anyway, it's great to have you here with me. I'm Dr. Sylvia. This is AskAwayHealth. Thank you so much for joining me this Saturday afternoon for a 30-minute stream. We're going to be looking at breast cancer awareness, and I actually haven't streamed since August or so because of one thing or the other, and I really wanted to use the opportunity of October being Breast Cancer Awareness Month and, of course, Black History Month to do a little bit of work raising awareness about this condition. So thank you so much if you're joining me. It's great to have you here. Please say hi, where you're watching from. Thank you so much for being here. I really appreciate it. And let me just use 30 seconds to say thank you so much to new subscribers. I don't think I've had a chance to really say that, but we've got so many new people joining our community, and I'm so grateful. I'm really happy that you're getting engaged with me, and would always love to hear back from you what kind of topics you want us to address, what kind of deep dives you want us to go into, and so on. But just welcome and thank you so much. Okay, so without further ado, we're going to dive into today's topic, which I think is so relevant for us as women generally, but particularly for the Black community, for some reasons that I'm going to make clear to us in a couple of minutes. So let me just pull up my screen, which hopefully you should be able to see. Let me just double check that you can see this. My screen. Oh yes. Hopefully. Right. So you can see my screen, and it's breast cancer in Black women. I just put a few things together on this video I prepared ahead, and I'm just going to talk us through the points as they come up, really. So the key thing, and what I really want us to go away with from this video, is about advocacy, and why is there a need for advocacy. Both individual and collective advocacy is about the fact that Black women are often diagnosed with later stages of breast cancer and more aggressive types. I'm not sure how loud that message is in terms of current thinking or in the general population, where not just amongst the medical, clinicians or medical people. I don't know how much this is really sinking into people's heads, but this is so important that Black women, for one reason or the other, and of course I realize that my audience is not just in the UK or in the US or in Nigeria or in Ghana or different parts of the world, and of course the reason for relatively poor diagnosis in particular groups of women can be different in different countries or in different regions. But there are concerns, and I want to highlight them in particular, about why we Black women sometimes struggle with getting early diagnosis or getting treatment on time that could give us a better quality or prolonged life after breast cancer diagnosis. So this is something that we're looking at. It's because I want us to have a look at gaining advocacy and what else can we do. What are the things that we can do? What is responsible for this situation? So here's a little fact. I have got a lot of references. I'm not going to sort of, label you with them during the stream, but I will put them in the description box once I've got a chance after the video. I will list the different sources for the different statements I'm making, and a lot of them will refer to some US studies, but I think we can sort of borrow information and knowledge from that. So here's another statement from fightcancer.org, which is that compared to other races or ethnic groups, Black women are more likely to be diagnosed with breast cancer at a young age, which is under 45, and at later stages of the disease when it is more difficult to treat. I am going to look at breast cancer staging on a slide I've got towards the end of this, so you understand what staging means. But I think the nub of this particular statement goes to the fact that whereas you would think that breast cancer, and this is not saying in all cases, but more commonly, where you should have diagnosis of things like breast cancer should be in the older age, sort of 50s upwards, 55. But we're seeing it at a younger age in Black women under the age of 45. Now, this doesn't mean that in other ethnic groups, they don't have breast cancer younger. That doesn't mean, we're just saying that comparatively, that we are seeing in Black women developing or getting diagnosed with cancer at younger ages compared to other groups. It seems to be more you seem to have larger numbers in the Black ethnic groups. And the other thing is about later stages of the disease. And of course, you will appreciate that if you pick something up earlier, you can probably get a better treatment outcome if you tackle it then than if you've waited until later when it's either spread or it's a bit more difficult or challenging to treat. So that's why this statement is also quite relevant. Now, the next one I wanted us to sort of ponder on as well is this that says research shows that Black women have a 2.7 times higher likelihood of being diagnosed with triple negative breast cancer. So this is something else that you want to look at. Not only are we having the diagnosis at younger ages, not only are we having them diagnosed in later stages, but we're also having the more aggressive forms that are harder to treat and more likely to come back. So that's, I mean, it's not just a one whammy or a double whammy, a triple whammy of not very nice things. And so one really needs to pay attention. What is this? Why is this happening? Let me just take a quick pause and just, if you want to drop a comment in the chat, by all means, you're very much welcome. If it's a question on this subject, I'll be happy to look into it. But if you're just joining, we're looking at breast cancer in Black women, why we need to be more advocates in terms of for ourselves, for our sisters, our moms, our daughters, and for our communities. Remember Black History Month, saluting sisters is the theme, and so supporting sisterhood. And this is one thing, the rates of breast cancer are significantly high, as you will know, one of the most common cancers in the world. So the more information we have out there for our girls and our women, the better for us. So we've looked at this one, haven't we? So this is what I call sort of like the triple whammy. It's not just in terms of early age of diagnosis, late stage of diagnosis, then you have the more aggressive one as well. So this is another statement that after diagnosis, Black women are more likely to experience delays in treatment of 2 months or more, and are less likely to receive adequate treatment than their white counterparts. So this is pulled directly from a US study called Health and Racial Disparity in Breast Cancer by Yeju et al. It's 2019. I'll place the link. And I thought, like I said, I prefaced this and I put a disclaimer to this before I started, that the access to treatment is different. In the UK, we have a different healthcare system than in the United States, than in Sweden, than in Nigeria, than in the Philippines, and so on. So they're different types of systems, and they have their own peculiarities that might explain why access could be challenging. But we have a study here telling us the experience of Black women. If we go into Ghana, for example, or Kenya, for example, and start looking at demographics, you might find that there are different reasons. For example, information access, money, availability of different diagnostic, or treatment tools. Different things could explain why there are delays. But this is a US specific study, so in terms of their own healthcare system, you can explain why this is a peculiarity. But I wouldn't be surprised if there are not similar scenarios in other countries where there might be the same type of healthcare. The healthcare practice or healthcare system. Okay, so I've just sort of slammed you with all those statements. I've slammed you with all those statements, and I did that for a reason. I did that because I wanted to excite us and think this is why this issue needs to be discussed, and that's why I've put all that together. So now we're going to look at the reason why are we getting these risks? Why is this such an issue in Black women? Okay, so let's continue on with this. And there are a lot more. There are more than one. It's not all. You won't find them all the same in a particular woman or Black family or Black community. Could be a mixture of different things. But I just want you to have a thought. I want you to think about them and just think, how does this apply to me? How is this relevant to me? Okay, so the first one is genes. And the statement is that gene changes, that's genetic mutations or gene changes that happen more commonly in Black ladies, are also associated with an elevated risk or a higher risk of breast cancer. So what we're saying is that along the line with different conditions happen for many different reasons, and some of them could be because of changes to the DNA or the genetic print of that of genetic material within your system, and that causes this condition to develop. So if from your grandparent or your grandmom to your mom to yourself, if there's some kind of mutation within your system, within your DNA, that could lead to the expression or development of a condition. And what they're saying is that based on the research that has been done, it appears that those changes, those gene changes that happen more commonly in Black ladies, are also linked with high breast cancer risk. So it's something to do with our genes. That's the long and short of all this I've been saying. Something to do with our genes. Excuse me. There's also the possibility that there are some differences between Black women and white women that might explain why breast cancer spreads so quickly in Black women, and why there's a higher death rate in Black women. So there may be some differences, some gene differences that we still need a lot more studies about. And I will talk, when I get to that slide, I'll refer to why it's so important, why that issue about studies is important. But what you need to have in your head is that there is something to do with our genes that is making us more at risk compared to other ethnic groups. So let's look at what the next one is saying. And while that's loading up, I hope you guys are doing well. This is not going to be a very long stream, I promise. But I hope that it would condense information or just inspire you to just think a little bit more about what is your own healthcare situation. Do you need to be doing anything to keep yourself safe, to prevent, to reduce your risks, or do you need to be doing anything for friends and family and so on? Okay, so this is the other one. This is the next slide. This is another. We're looking at what is it that makes breast cancer higher in Black women. Access. So I've said it a couple of times now, so I'm not going to belabor the point that in different regions of the world, you have different healthcare systems, different way that you go from, I want to see a doctor. So you might have, like where I practice, the NHS, where you can go to see your GP with a concern about your breast, and then you get referred to the breast clinic, which is a standard procedure on the NHS. It's slightly different the way they practice in the United States in terms of how you can access, and because you don't have to worry about having to make payments at the point. Of course, in the NHS, it's funded through taxpayers' contributions. So you have a slightly different format, or well, not slightly, you have a different format in the United States, you have different format in other countries. For example, in Nigeria, you may need to, if you want to see a breast specialist, you may need to go private to see that breast specialist. So you might need to make out-of-pocket payments in order to do that. So that may explain why a woman might access care later in one instance, especially if she doesn't have the money to do that. Or if there are challenges in accessing the care, for example, in the US system, if there are challenges in accessing the care as soon as, or a woman doesn't have the money to pay, or she cannot make her insurance payments, that might make it difficult for her to reach out to get the help when she needs it. So the point is that access is different geographically, but access is an issue. Okay, so in some areas it might be better than others, and in some areas access may not be the issue, may not be why a Black woman gets treatment late. There could be something else going on. But in terms of access, some studies found that even though there are similar breast cancer screening rates in both Black and white women, but Black women are more likely to be diagnosed in the later stages, which is when the cancer has already spread. And they're suggesting that this might be due to lack of access. And I've mentioned why the access might be a problem. It might be the type of system. It might be the fact that there isn't enough money. It may be lack of awareness. It may be that there are not even enough screening opportunities in some countries, or in some parts, in some areas. There may not be screening opportunities. There might be delays in screening due to manpower, or different things could result in access issues. So let's not belabor the point. Access is an issue that we need to do something about to ensure that we try and reduce that risk, that gap between breast cancer diagnosis and treatment between Black women and other ethnic groups. The next point, the next reason why a Black woman may suffer more aggressive cancer, have it diagnosed earlier, or even not have it diagnosed until it's at its late stages, could be if she has pre-existing conditions. Now, these are things like diabetes or high blood pressure, that being overweight, these chronic inflammatory conditions that whose presence may limit the kind of options you have for treatment, and they could also have a negative outcome. So just because they are present, they already cause some kind of complication within the body, making it more difficult or challenging for treatment. The thing is, these conditions are also quite higher as they occur in Black women. So that's the other challenge. So when we're now thinking about prevention, these are some of the things that we need to be thinking about. So this could also be something else that's shooting the cause of Black women in the foot, because there are these pre-existing conditions that we're already burdened by simply because of our genetic makeup and because we are Black. You may want to look at why do we have higher prevalence of these illnesses in Black women. That's another story altogether. But what we're saying is that the fact that they are there can contribute to why we're seeing more incidents or more occurrence of breast cancer within the Black community for Black women. Now, this one is one I thought was really important to reference. Okay, and this is and this is underrepresentation in clinical trials. Okay, and I'm going to share something else. I hope I don't lose my space, but I'm going to share something else on that issue, which I hope it will let me share something else. Says extra no, not that one. Let me see. Oh, I might need to come back to that. Now, let me just share something else with you guys, which I think is relevant. Okay, so this is a page from The Guardian. I hope you can see this. I don't know if you can see. Yes, you can. Okay, so this is from The Guardian paper. There we go. So this is on The Guardian paper in the UK, and this is an article from August of this year, so just a couple of months ago. NHS urges breast cancer patients from minority backgrounds to participate in trials is the headline. Research shows young Black women more likely to have more aggressive cancer and receive poorer care. We've already established that. This is a UK report or article. So just to read it really quickly for us, it says an NHS body is encouraging women with breast cancer from minority backgrounds to take part in more clinical trials after research found they are underrepresented in studies that can offer life-saving treatment. Okay. So I bring this up because this does tally nicely with the point I'm just making from my video. Let me bring the video back for us. Give me a second. So let me put the video back. And that's why I thought it was really important for us to look at that. Yeah. So that's why I thought it was really important for us to look at that Guardian article. And this is within the last couple of months. It's not something that was 2 or 3 years ago. It's quite recent. The point is that treatment guidelines for breast cancer may be ineffective for Black women because a lot of us are not showing up in studies so that they can look at, so scientists or researchers can look at the progression, to look at what are the specific risks, what are these gene changes, and how can anything be done, and how can something be done about them. So because a lot of us are not showing up for these trials, we are not specific treatments that will be effective for us are not available. So that's the challenge. And increased participation by Black women in clinical trials can help scientists develop more effective treatments to reduce mortality disparities. All that is saying is that, yes, we need more women, more Black women in clinical trials. However, we need to ask ourselves, well, why aren't Black women coming forward for these trials? We know that historically there is the issue of distrust. And so we can't get away from that. And I do think that a lot more needs to be done in terms of increasing and improving the confidence of other ethnic minorities, whether it's Black women or Asian communities or whichever groups that are traditionally less likely to seek care from institutions because of the experience, because of what they've heard, not just in the UK, other countries around the world also have similar experiences where Blacks have felt undermined or have felt we've been taken advantage of. And so we don't naturally trust, we don't trust, because we're not sure whether what you're saying is actually for my benefit or is there something else going on. So there is that. It has to be overcome. How can it be overcome? Transparency, providing awareness so that it is clear this is what is available. And then when you say something, stick to it, keep to it. And then, of course, the way that Black women, the kind of care that they experience, both in primary and secondary care, different parts of the world, also that needs to be addressed so that it's seen to be the same. The prejudices that we have about Black women and how we might respond differently to pain, for example, I'm just using that as an example, that things like that need to be things of the past. The fact is that Black women still suffer poorer care, for example, in terms of giving birth. In terms of giving birth or in seeking care, there is still a gap. And this, I'm talking about recent figures from this year or late last year, still indicate that there is still a big gap in the UK between the care that Black women receive compared to the care that Caucasian women receive. So when you have those kind of figures, is it surprising that there is still underrepresentation by Black women in clinical trials? No, but it is important. It is important that different groups are represented in different trials. There are some differences that we have. Yes, it's the same human body, it's the same anatomy, but there are some differences. And by appreciating those differences and studying them, then we can help each other. We can help everybody make the most out of the available research, the available technologies that have developed over years. So the last one, the last risk factor I'm going to look at here, which I know is a bit of a, I don't know whether to call it a loaded dart gun. I don't know what to call it really, but it's one of those things. There is evidence that some cosmetic products, this is not to say that other women don't use cosmetic products. So it's strange that it seems to be targeted towards Black women. But some cosmetic products that are used by Black women to, what's the word now? I don't want to use the word perm, straighten or relax the hair, for example, are more likely to contain endocrine disrupting chemicals. So these can be linked to an increased risk of breast cancer. And specifically, there are things like, there are chemicals like parabens or phthalates in the hair, skin, nail products, hair relaxers, like I've said, moisturizers or lotions, leave-in conditioners. So what we're saying is, as you make your purchases, you're looking at what's the content. Yes, instead of the frizzy African hair, some women choose or opt to change or straighten their hair, and that exposes them to those chemicals. So there may be, if you know what your family history is, you know that there may be an increased risk of cancer in the family. You may choose that you don't want to use those products, but it's good to put this here. It's good to put this here because research does indicate that there may be something going on here. A lot more work is still being done because we're not saying that you should stop using those products altogether. And there are a lot more endocrine disrupting chemicals that are household goods. Generally, there are a lot more on the list, but just highlighting this just in case there's somebody there who has a family history, looking at how to manage their risks, looking at what things that they themselves can do to help. I think this is also useful to add to the list of things. So let us move on. I believe the next thing that we're talking about is what are the things we can do to prevent. So before I go there, again, I'm just going to pop in to see if there are any questions. I haven't got any. If you're watching on the replay as well, you're welcome to chip in your experience, any question around the issue of breast cancer awareness, if you want to do that, if you want to share that with us, or any questions you wanted to ask around the issue. But right now we're just going to look at the issue of prevention, and I've sort of given a single slide to breast self-examination, where we encourage all women to examine our breasts every month. Not because we're asking you to be a detective to find a lump, but we just want you to be familiar with what it feels like, so that if something pops up that is not the usual, you quickly come to your doctor. That is pretty much all it is. And so usually you're advised to do it after your period, if you're still having a period. Get into a comfortable position, either lying down or if you're doing it in the shower, but sort of try and find a regular time of the month. Maybe put an alarm on your phone to just remind you that you need to do that breast check. And then extend it up to under your arms as well, the armpit as well, and you're checking to see if there are if anything's changed. And it's not just about feeling, it's also about looking. And on the next slide, I'm just going to quickly go through some of the symptoms just as a reminder, because I know that we've probably heard, but there may be somebody here who hasn't heard that these are the symptoms of breast cancer. And I think this is a good place to say it. I recently heard of somebody who, a Black lady, and I do believe she is under the age of 40. If at all she's over 40, maybe very, very early 40s, who was diagnosed with stage 3 breast cancer. And I don't know the ins and outs, I don't know anything else, but it just sort of buttresses what we are saying about early age of diagnosis. I don't know the type of cancer, and I don't know so much information. But I think as I heard that, I think that just resonated with me, and I really wanted to get this message out. So in terms of symptoms, a new lump or thickening. I mean, it doesn't have to be a specific lump. If you feel something different, please seek advice in the breast tissue itself or under the arm. Okay, it doesn't need to be a specific. I don't want ladies or girls thinking that, oh, they've got to feel something exactly. No, you may just feel this doesn't feel right. Go with that feeling and get your doctor to check it out for you. Or there may be a change in the size, the shape or feel of your breast. So you're looking at the breast and you think, oh, this looks a bit different. And it's not, so if you get into the habit of sort of looking on a regular basis, then you can tell when there's a change, whether it's the way they feel or in the shape of the breast. Skin changes as well. And that could be dimpling or a rash, or it might look puckered, and I'll show some pictures in a second. Or redness or rash, any skin changes around the nipple, around the whole breast itself, please bring that to the attention of the doctor. Now, I will say that there are other conditions, could be eczema, it could be skin irritation. Yeah, but let us be sure. Let's check first before we make that conclusion. The other thing is nipple changes, leaking from the nipple. So you may have a discharge from the nipple. You're not pregnant, you're not breastfeeding, and there's an unexplained discharge. Come and let us see what could be responsible. I'm not saying it's always breast cancer, but it is wise to check first, okay? Let me just get a drink because I've got a really scratchy throat. Okay, that's a bit better. So we've talked about nipple discharge, the position of the nipple. So if it goes from being sort of, poking out, being everted, either it goes flat or sort of pushing inwards. If that is a change, then you do need to come and speak to your doctor so that we can examine and find out what's going on and do necessary tests. I've just added here at the bottom that breast pain is not common. By the way, these are symptoms from Cancer Research UK. I just added that breast pain because a lot of ladies think, oh, breast pain and oh, it must be cancer. Not in the early stage. I mean, it's not a common symptom of cancer. I beg your pardon. Of course, I do understand if it's spread and the skin is stretched or there is an ulcer in the breast, that can be painful. But in very early stages, breast pain is not a common feature of cancer. It could be of other things like mastitis or an infected breast cyst and so on. But regardless, please, if you are experiencing any change, pain, or anything that is different to your breast, please seek medical advice, okay? Like I said, this is all for information and education. I don't want you to think, well, I said breast pain is not a symptom of cancer, so you won't worry. If it's something different, I will get it checked out. I would like you to get it checked out. Also, here's just a quick look at the different some of the different skin changes that you could have, the dimpling, some of the rashes, the puckering and so on. But like I said, it may not look like this on your skin. You may not get these exact features. So what you should be looking at is something that's different. So before we finish up, I wanted to look at the stages of breast cancer. I've just talked about a lady who has stage 3. Staging is just a way of categorizing the spread, or what's the word to use now? It's just a way of putting the extent of growth of the cancer into a particular way that will allow treatment, or that will guide us to know what do we expect this cancer to do next. So by putting it in a particular stage, it tells us that, okay, this is an early growing cancer, and that if it is treated with XYZ options, then the likelihood of cure or the likelihood of remission is this. If it is a late stage cancer, for example, then it tells us that the treatment options are, this is what we can do. The chances of cure are so, so, and so. So that's what staging does. It's really there to help us to put the cancer into different, it just helps your doctor to plan your treatment. It just tells us, it gives us information about the nature of the cancer. I think that's the better way to put it. So stage 1 means that it's a cancer, small cancer. I'm sorry about my spelling there. I didn't even notice that. It's a small cancer. It's within the breast. Or it might be in the lymph nodes close to the breast, which is why you check on your underarm where the lymph nodes are. Stage 2 means that the cancer is either in the breast or in the lymph nodes or both. So it's an early stage. So 1 and 2 are sort of early stage cancers. Stage 3 means it has spread from the breast to the lymph nodes close to the breast, the skin of the breast, or to the chest wall. So that's advanced a little bit from stage 2. While stage 4 breast cancer means that the cancer has spread to other parts of the body, such as the bones and lungs, which is late stage. So each of these stages, there are implications for treatment. I have to emphasize that the earlier we pick it up, the better. So it's important. So what we're saying is that it's important to the reason it's important to examine your breast, like I've said, is because that helps you identify what your breasts normally look like. And so if something unusual happens, you pick it up faster. And that means when you pick it up, you come and, speak to somebody about it. Either, can you just check this? I'm not sure what I'm feeling. I'm not sure what I'm feeling is okay as a symptom. It's okay not to be sure. Because then you get somebody else to check it and we say, do you know what, let's have a further look at this. So you don't have to be 100% sure or convinced of what you're feeling or seeing. If you're concerned, please come. One of the things I didn't mention, I can't remember why I forgot it, but I think it's so important for Black women and seeking care, is also perhaps belief system. I talked about the issue we have, lack of confidence or trust in certain systems or institutions because of our historical experiences. But there's also awareness and just not knowing. So you might think, oh, I felt something there, perhaps it will go away. And we keep, perhaps it will go away, and perhaps it's nothing. And we might think all sorts of different things. And I have personal experience of this. My mom had breast cancer, and we did go through a period of denial. And of course, this was so many years ago. And pretty much as I came into medical school, so it was, I witnessed firsthand what, could it be this, could it be that? So just that delay, we found something, we knew there was something, we knew it was something different. But to take that step from when we could tell something was different, with so many times of checking the breast and can you actually feel something? Oh, maybe there's nothing there. Can you? There was a while from that point to going to see the doctor. And there are many reasons behind that. Of course, there was also fear. There was, the awareness and different things. And while nobody's judging or blaming anybody, the important thing, the message really is, if you do pick up on something, please come and speak to your doctor as soon as possible. Okay, so this is just a list of things to do to prevent breast cancer. I've talked about self-breast examination and why it is important for early detection. If you want to go ahead and get your doctor to have a look, come on, please, and say to the doctor, I'm concerned. Could you just reassure me? And it could be, like I've said, it could be, because you felt something, or it could be something that you want to do on a regular basis, maybe as you get into your 50s or, get a bit older. It doesn't have to wait to that point. You can decide you want to check in with your doctor every 6 months just to, for them to check the breast and can they feel anything. But the other thing that's really important is the mammogram, which is the X-ray that looks at the breast tissue. Different countries have different programs. Other countries, you can order your mammogram, and have the scan. I think the message I want us to go away with is that it's an important tool to help us detect any changes in breast tissue. So it's something that you should look at what is available where you are locally and how that can help. It's just one of those, screenings. I didn't really want to go into detail into the different diagnoses of breast cancer. That's not the purpose of this sort of session. But things like biopsy, things like scans and so on can be done. But mammogram is one of the sort of basic screening tools, an X-ray that looks at the breast tissue and helps to pick up any changes. Then they can go on to investigate them further. Other prevention, healthy lifestyle, moderate diet, regular exercise, all this is just simply to keep down a normal weight, because excessive weight, being overweight, being obese, these are associated with increased risk of cancer, different types of cancer, not just breast cancer. So, it is not, it's something that I, as a practitioner, as a physician, will still say you are healthier at a normal weight range than being overweight or obese. And this is by no means putting down or beating down anybody who's overweight or obese. It is simply stating the facts and what you can do to encourage your weight to come to a normal range are things like being consistent with a moderate diet. Nobody's saying to starve or to stay away from favorite food types, but look at something that is sustainable, that you can stick to, and you will be rewarded with good weight and sustained weight loss over time. Regular exercise may be as simple as walking or swimming, but something that you're doing over time, and that helps. It helps to reduce inflammation in your system. So there's so many different benefits. Of course, things like cutting down alcohol and stop smoking, these two factors have been associated with breast cancer. Know your family history. I just put it there because, we talked about genes at the beginning, and I think it's important that you know whether within your family, whether it's your mom, aunt, dad, uncle, whoever, both nuclear and extended family, have experienced some form of cancer, what type of cancer, just to have that information. And I'm not saying that only people with family history develop cancer, of course not. But I think it's useful for you to be aware of that information. And if there is that risk, what are the things that you could do to further reduce your chances of developing the condition? Access is so important. Access is so important. I've spoken about it to a great extent. And of course, being informed, which is the purpose of this session, this live stream, to stay informed with latest guidelines for cancer prevention and screening. That is also important. Whew. So that was a quick whistle stop. How long have we done? Oh, 38 minutes, guys. I'm going to round up now, and I hope you found that useful. Perhaps there were not too many things that were brand new in this stream. That's fine. The intention was to remind, encourage, and if it is something that is new to you, then hopefully push you in the direction of being more conscious about examining your breasts or knowing what to do if you're not sure, and not leaving it waiting long before you actually do something. I hope it's been helpful, guys. Thank you so very much for joining me today. I know a couple of people were on the stream. I appreciate you joining. And if you're watching this on the replay, please don't forget to give the video a like, and of course, subscribe to the channel. I do weekly live streams, although it's been a bit busy quite recently. So I might adjust my schedule. I don't know. I'll let you know on the community post. But if I have something I think is really important for us to chat about, I will definitely come back to you. Thank you so much again, guys. Have a great week. Bye-bye.